Yeah?
Yes.
Okay, great. All right, so my name's Alan Mednick. What I'm doing here is I am a board member with the American Foundation for Suicide Prevention. I'm also a field ambassador for the American Foundation for Suicide Prevention. So basically what that means is I advocate, go meet with politicians. I was supposed to be in DC last week to go to the Capitol. We're actually going to do a virtual day at the Capitol on Monday. But basically, this isn't a business for me. This is a passion. And everything starts with mental health. And I think, the one connection everybody has is mental health. So basically, the reason why I got involved with this, and I'm going to tell my story a little bit. And the reason why I tell my story is not, for people to feel bad or anything. It's the more I talk about it, and Brian could attest to this, the more I talk about it, and I talk about my involvement with the suicide prevention more than I do my insurance practice. And after like meetings, people come up to me all the time and start telling me their story. So this is more because we got to get the voice out. The more we talk about this, the more people will feel comfortable in expressing their feelings too. So in that, I'm going to do a presentation, but my story started about 7 years ago, a little over 7 years ago, when my daughter took her life, my daughter Raven. She was 19 years old. So that was back in October 13th of 2012. My son was 10 years old at the time. And when he turned 11, he started showing signs of anxiety and depression. So we started having to get him help. And then 4 years after that, my niece, Ayla, took her life. And coincidentally, she was 19 too. So this started becoming a big passion for me. And this is something I do voluntarily. It's not a business for me. Like I said, it's a passion. So I started getting more involved, mainly because I didn't understand why people would go ahead and do this. And I didn't know how prevalent this was in society. So the more I got involved, the more you really don't understand, but you could try and help more people. In 2015, my son had to go into an outpatient facility. And when he came out, I needed to do something for him. So and make a long story short, I didn't like the way sports was going. He was a big baseball fan. So I started a program called the Sudbury Ravens in the town that I lived up in Massachusetts. And basically, it was named after my daughter. My daughter's name was Raven. And I incorporated basically mental health, suicide prevention along with youth sports. And it wasn't to tell people, the kids about, suicide or anything. It was about to teach them life lessons and how making an error, what you do after that. You just don't throw your glove down, you think about it, and then, obviously you move on. It was more life lessons. So after that, my son had to go into an inpatient facility in 2017. After that, we decided to move down to Florida because I have a lot of family down here. Weather, everything else was much better for him. So that's pretty much in a nutshell why I got involved with this. Now, when I moved down to Florida, I got on the board of directors with the American Foundation for Suicide Prevention. And doing that, I also became what's called a Safe Talk trainer. And also I am trained to do what's called Assist, which is an intervention program. So I'm trained to do interventions through an organization called Living Works, which is the largest suicide prevention education organization in the world. So that's where I'm at now. And with the education, I do it for free. So if there's any organizations that want to do it, or we could get together, I could do a Safe Talk training. I've done trainings for everybody from middle schools to, I've done one at the Marjorie Stoneman Douglas. I've done recently in January, which was an honor I did for the United States Southern Command military base in Doral. So again, this is for everybody. And Safe Talk basically stands for Suicide Awareness for Everyone. And that's basically where we're at. Now, the presentation I'm going to do today is called Talk Saves Lives. It's typically an hour program. These programs usually run from Talk Saves Lives is an hour. There's More Than Sad, there's Safe Talk, there's a bunch of them that I do. I'm going to really condense this. So it's going to go pretty quick, but hopefully you'll get the idea behind it and everything. So again, it's called Talk Saves Lives because that starts everything. The conversation to start the talk behind suicide. And again, although this is suicide prevention talk, I incorporate everything: mental health, substance abuse, eating disorders. To me, it's all the same. And what we're trying to do is just help everybody out there. So, as you know, it says right here, suicide is a health issue. And what we want to do is we want people to understand that it's not a choice. It's an actual illness. It's proven, research shows that it is an issue, just like a heart attack, just like diabetes is an illness. Mental health is an illness. And we know that it can be prevented. And there's studies to show that with the training, with the research, with the way we do things, it can be prevented. So what we're going to do is go through some of these, the scope of the problem, research, prevention, and what we could do to help people. And hopefully I'll be able to get through everything real quick. So how we talk about suicide really matters. So you hear a lot of people talk about stigma. And what is stigma? Stigma is being ashamed to talk about it, not, being, saying that basically, someone's crazy, whatever. It's not that. So the reason why I started talking about it so much is because when my niece passed away in 2016, I was driving down to her funeral in Maryland, and I had a call from a friend of mine who was pretty prominent. He was in politics. I knew him for a long time. He said, "Al, I'm sorry about your loss, but I can remember when I was 18 and my brother took his life." And that just resonated with me because I knew this guy. My daughter already passed by suicide, but he didn't talk. He didn't tell me anything. And to me, it took like he was ashamed to talk about it. And the only way we're going to get out there and really help people is to talk about it. Just like I relate a lot of things to AIDS. AIDS, when it first came out in the 80s, everybody was petrified that if someone breathed on you and they had AIDS, you were going to catch AIDS. It took knowledge, education, and talking about it to really be able to understand that, hey, nowadays, if you have HIV, it's undetectable. And actually, HIV right now is in the same category as asthma. And that's where we're at right now. So we got to talk about it. So basically, the way we talk about it has a big stigma behind it. So as you can see here, the language do's and don'ts. The typical term everybody says is committed suicide. I have a friend that committed suicide. I had this. That study shows, and everything that we talk about is all research, that shows it actually hurts the stigma behind it. The reason why is committed actually means committing a crime. And actually up into the 70s, it was actually, if someone attempted suicide, you could go to jail for it. So committed is something that we really want to take out of the language. You hear it every day. Everybody says it. It's just one of those words. But do you ever hear anybody say committed a heart attack? I committed a stroke. You don't hear those words. So again, when you talk, everything that is below the neck is physical. Everything above the neck, mentally, we should be talking about in the same realm. So we're trying to take that word committed out of there, and it will have a big impact on the stigma and having people not feel as ashamed. So, and the other thing is failed or successful attempt of suicide. The reason why we don't want to say that is because if you attempted suicide, obviously you're still living. If someone says I attempted suicide, you're still around. So you don't have to put those words failed or successful in there. So what's the proper way to say if someone died by suicide? That's it. Died by suicide, ended their life. You could say killed themselves, suicide attempt, or death by suicide. Again, you don't want to say, even if someone attempted suicide, that they hurt themselves. Because again, hurting themselves could basically mean that you just banged your knee. So these are the terms that we like to use. Okay, so we're going to go into a little bit of the scope of the problem. Now, we say that we're in a pandemic right now. The coronavirus is a pandemic. Well, guess what? We've had a pandemic for years. Over 800,000 people die by suicide every year. And those are the ones that are recorded. So, if someone, did an overdose, drug overdose, something, a lot of those aren't counted in this number either. And to me, it's the same thing. So this is worldwide. In the United States, and it says here, someone dies by suicide every 40 seconds. So in the United States, it's the 10th leading cause of death. In Florida, it's the 8th leading cause of death. And between the ages of 10 to 34, it's the 2nd leading cause of death. So it's a pandemic to me. It's something that we really got to address and get out there. As you can see, in 2018, 48,344 people died by suicide. The year before, in 2017, it was 47,000. So, and in 2016, I think it was 43. So there's been that increase. So we got to turn it around. And again, for every suicide, there's 25 attempts. So in 2017, 1.4 million attempts of suicide. Again, that's only what we know about, because if someone attempted and didn't go to the hospital, we don't know about it. So again, get back to pandemic. But I also want everybody to know with these numbers, again, I'm telling you, suicide is preventable. So suicide impacts individuals and communities. I will tell you, if you don't think you have a connection to it, you do somehow. It's silent. So that's what we're trying to do. We're trying to really get it out there that say, hey, you know, you got to remember back in the 60s, if someone had cancer and died by cancer, you know, it was basically, you didn't want to say it. You were ashamed to say that someone had cancer, and they said, yeah, he died by cancer. He had cancer. If you guys could hear me whisper. And we're at that point now too with suicide, and we got to make it equal that, you know, hey, cancer's out there. People die by cancer. People die by strokes. People die by diabetes. It's the same thing with suicide. It's nothing to be ashamed about. This slide I really don't like that much, because I don't like to put it, I'm more of an emotional person. I don't like to put it into dollars, but we have to sometimes, especially when we try to advocate. But $69 billion per year is spent in the US for suicide. I will also tell you that that mental health in general is the #1 leading cause for disability in the world. So again, pandemic, I keep on going back to that. So what has research shown us? There is really no single cause for why people do take their lives. So, you know, I'm just going to go back 1 second to that other slide. So someone breaks up with someone has lost their job. It's not enough to really, for someone to take their life. We know through research that the human nature wants to live more than it wants to die. It really takes a lot for somebody to get to that point where they want to take their lives. So but again, the large majority of people that do die by suicide, and it's 90% is pretty much the number, do have a mental health condition contributing to their death. So this slide basically shows that 1 in 4 people will experience a mental health condition this year. And I believe it's 1 in 25 will have a mental health illness. So again, I'm sure everybody knows 4 people. It affects everybody, you know, and again, especially in the times that we're in now, coronavirus, with the economics, job, isolation, it really has an effect on everybody. And again, research, physical differences, the brain of people who die by suicide are different. I have a friend that's has a nuclear imaging business, and he's actually showed me differences between people's brains that, you know, so-called normal people, but somebody that does have depression, somebody has substance abuse, someone that even smokes marijuana, you know, even someone who smokes cigarettes, you could see the difference in people's brains. Okay, most people, I'm going to be skipping through some of these to try and get through the whole thing. Again, this is what I mentioned before, that, you know, there's been a crisis point that has been reached. People that, again, like I said before, people that die by suicide, people don't want to take their lives. Human nature is not to take your life. So you got to understand that if people, I use it this way. I had a motorcycle accident in 2010. I broke 9 ribs, my neck, collapsed lung, contused lung. I was in a lot of pain, especially in the ambulance ride with, you know, a broken rib punched through my lung, going in the ambulance, shaking back and forth. There was a lot of pain. People that are on the verge of taking their lives, the pain is probably about 1,000 times what I went through. It's a physical pain. So what you guys were saying before about the mental aspect of it, the mental aspect can actually have a physical effect on you. My son has anxiety. When he gets really anxious, he gets stomach pains. It's a physical pain that he gets. So who's at risk here? Basically everybody. So the risk factors are basically broken down to 3 categories: health, historical, and environmental. So basically the health factors, as you can see here, are basically depression, bipolar, anxiety, eating disorder, personal disorder, psychosis, PTSD, and substance abuse. Now, a lot of these will be co-occurring too. So a lot of people that are depressed will also have anxiety. Substance abuse, I think it's about half of people that have substance abuse also have depression. So, you know, there's multiple things that go on here. And other health factors are here. Historical, obviously, family. So again, we go back to the heart attack. If you, like my father had a heart attack, so actually have a bigger history for it. My father had diabetes. My sister has diabetes. I have more of a tendency to have diabetes. So it's the same thing with someone that has a mental health condition. And then environmental. Right now, we're in an environmental with the coronavirus, prolonged stress, access to lethal means, which we can get into that a little bit too. Stressful life. So again, exactly what we're going through right now with the coronavirus and isolation. Okay, so I'm gonna, again, go through some of these pretty quickly. Importance of research. This is what we do. This is what we're, okay, so now we get into the prevention. So what are we gonna do to be proactive? You know, obviously, you know, one of my big pitches that I'm trying to do is, you know, every year everybody goes for a physical, right? You go get your body checked out, the physical. We should have a mental wellness checkup every year too. And that could be really good. So that could be a proactive. Okay, so mental health is important. And we need a culture where everyone knows to be smart about mental health. So basically what we're talking about here is one of the things that we teach. So when I do a Safe Talk training, the Safe Talk training, basically what we're trying to do is have a suicide safer community. We're trying to have everybody more aware of people around them and what they could do. Now, we don't need to be counselors. I don't need to, and Michael, by the way, if I'm starting to get a little bit long here, let me know how much time I have left. If we, you know, if everybody could just be aware of what's going on around them, and there are ways to do that where you don't have to be a psychologist, you don't have to be a doctor. You could just be a person that cares for somebody by just asking somebody, you know, are you okay? How you doing? Talking to somebody, listening to somebody makes a big difference. So again, we talked about being proactive about mental health, getting evaluations, working out, doing things to really relieve the stress. So this is something that we could get into a little bit, but it says here the law requires insurance plans to cover mental health services the same as physical. That's not totally true. This is one of the things that we're trying to fight for right now, where the federal government did pass what's called the Mental Health Parity Act, which does say this. However, each state governs the insurance companies. So the federal government can't force the insurance companies to cover mental health the same way they cover physical health. It's each state that has to do it. And right now in Florida, we don't have that, which is something that we need to fight for. And hopefully with this telehealth, things will change too. So again, some self-care, strengths, mental health, exercise, healthy diet, which you guys talk about, stress management. But one of the things that is the most important is sleep. Sleep is one of the most important factors to mental health. Obviously, you put in all these things together, it's very, you know, you need everything here to really help yourself out with that. Okay. So I'm just going to skip through a couple of these things again. All right, so limiting access to means prevents suicide. So we know, and again, this is something that we're going to talk about, we know for a fact that the longer you could put between the thought of someone attempting suicide, the time is the main key factor. So if someone has the thought of suicide, the longer you could keep them, before they do it, the more success you'll have in saving their lives. So for instance, 51, and this is not a anti-NRA. I'll let everybody know I'm not anti-gun at all. All I am is I am for safe storage. So we know that 51% of suicide is by gun, by lethal means. So the thing that we try to do is just tell people, if you're going to have a gun, make sure it's stored safe. Myself, I have 3 safes. I have one from the gun, I have one for the ammunition, and I have one for the cartridge itself. So I keep everything in a safe. I only have the key, I only have the codes and everything. So by doing that, you could actually save people's lives. And again, limiting means access to different things. Again, if somebody is suicidal, if you can find out if they have like medication, stuff like that, just taking the stuff away helps out. So what can we do? The biggest thing is having a conversation with someone. Conversation, again, we want to get people to understand that it's not shameful. A mental illness is that it's an illness. Just again, I'm going back to heart attacks, I'm going to diabetes, I'm going to all that stuff. It's the same thing. You have a conversation about it, and 95% of the time, it's just about listening to people. Most of the people that have thoughts of suicide feel like they're alone and nobody understands them. And that's a big key. If you could just say to somebody, I care about you, you could save lives by just doing that. So we want to watch for the signs, reach out, and seek help. So we're not asking you to be the counselor and save somebody's life and telling them, what are you, crazy? You shouldn't be doing this, blah, blah, blah. No, listening, understanding them, and then helping them to get to a counselor. So suicide warning signs. So I'll give a little quick story. There's something called the Campaign to Change Direction. And if anybody wants to look at it, you could look at changedirection.org. In 2015, the White House convened a summit for, they wanted to come up with signs of mental health, the same that you have signs of a heart attack. So everybody knows that if you have chest pains, if you have shortness of breath, pain up and down the arm, it's a heart attack. They wanted to come out with something similar for mental health. So they convened this summit. They joined a bunch of organizations. AFSP was a founding member, an organization called Give an Hour, You Matter. They all came together. Michelle Obama was the keynote speaker, and they came up with these 5 signs of suicide, of mental health. And basically, they're just like anxiety and change of mood and the typical ones that we know now. So this is a campaign that's gone on. And again, the simplest ways to do it, the warning signs, are how people talk, the behavior, the mood of people. So if you see somebody doing something different, if you see somebody that is normally very quiet and all of a sudden they just talk a lot, that could be a sign. If someone just becomes, doesn't eat, if someone is taking more, drinking heavier, taking drugs, giving away things is a big one. Giving away pets. Those are all signs of someone that might be thinking about suicide. So behaviors, moods, and again, we're going to get into that a little bit now. So again, someone says straight out that they're thinking about taking their lives. They have no reason to live, that they're a burden on someone. These are all signs that someone's thinking about it. And again, unbearable pain. There is a physical pain that comes along with this. Again, like I said, increased use of alcohol, issues with sleeping. Again, a lot of anxiety causes a lot of this stuff. And then mood, depression, apathy, irritability. Now, again, we think typically about, if you have a child that is, normally an A student and drops his grades, or, waking up late to go to school. These type of things are easy signs, but it could be reversed. It could be somebody that all of a sudden was very, not emotional and all of a sudden becomes very emotional. That could be a sign too. And typically you look for a pattern of 2 weeks or more. So again, if a high school kid fails a test and he's depressed or he's upset, that doesn't mean that they're suicidal. But if it lasts for 2 or more weeks, that's the trend we try to look for. We always want to say, trust your gut. Don't ever feel like, hey, he's, suck it up, you'll get over it, whatever. If you feel there's something wrong, you have to reach out and you have to talk to someone. And again, these are some of the things that you could do. You could talk to them in private, obviously never talk to somebody, in public in front of other people. Try to take them aside and talk to them. But one of the most important things here is ask directly about suicidal thoughts. A lot of people think by saying that word suicide, that you're going to give the person the idea to take their lives. It doesn't happen. The human nature is not that impressionable where if I say, hey, are you thinking about suicide? Or somebody said, that's a great idea. It's not what happens. And you could actually either save somebody's life or you could help them. If someone's not suicidal, but gets going through some struggles, you could help them in that way too. So basically it's, real simple. Hey, are you okay? Yeah, I'm okay. You don't seem yourself. You seem like something's wrong. I know you. Sometimes when you lose your job, some people think about suicide. Are you thinking about suicide? Just saying that word makes a huge difference. And it's hard to say that word. It really is. The first time I said it, I got a lump in my throat. So what happens is when you say that word, the person on the other side is like, wow, this is reality. This is really, wow, am I really thinking about that? And again, you don't want to say, are you thinking about hurting yourself? Because again, you could just bang your leg and, I hurt myself. So it's important to actually say those words.
Hey, Alan, I hate to interrupt you, but I just wanted to see if we could turn it over for some Q&A. We've got about 8 minutes left. Just incredible information you're pouring on us. So I just want to turn it out to everyone to see if they have any questions, what you can clarify for us. So if anyone has any
I just want to say this one slide here and then that's it, because the most important thing is if you do find out that someone is suicidal, this is really important. You want to stay with them. You don't want to leave them until you get them to help. So again, I want everybody to know that 211 is an incredible resource. There's a mobile crisis unit that you could have actually come to your house or school or whatever. But it's really important not to leave the person alone, to get them with somebody that they're comfortable with.
Okay. Awesome. Thank you. If anyone has any questions, feel free to just chime in.
I'll stop the sharing here.
Alan, I was wondering what your thoughts are. I heard this stat that, if, say, a father or someone in the family had taken their own life, that the children are more likely to do the same and that it kind of repeats in the family. I don't know if there's any validity. I think I heard that there's a 50% more likelihood of a child to follow in the steps of a family member.
So the stats I don't want to go into because I don't know the stats off the top of my head with that, but it's just like we talked in the beginning of the slides. If your father had diabetes, your father had a heart attack, you're more likely to have it. So yes, it is, but I don't want to discourage that from, anybody being susceptible to it. Again, yes, you're more likely, but every single person in this world has a risk of at one point maybe wanting to take their lives for one reason or another. So, but yes, if someone has had that, then yeah, they are more likely or more susceptible to it.
Right. Makes a lot of sense. Thank you.
So, well, hopefully it was helpful for everyone. Again, there's a lot of great resources out there. And by the way, I just got to plug, I do have a radio show that turned into a podcast that's hopefully now going to a TV show. It's called Real Convo. And if anybody wants to check, you can go to my Facebook page, Real Convo 1290. It's at. So, hopefully soon we're supposed to record our first 2 shows next Thursday. And it's America's Voice is the network that hopefully will be on shortly.
That's phenomenal. Yeah, I'm so happy to see you getting more notoriety and a bigger platform to share this info for on, and you know, totally appreciate you just laying it out all out there for us. I'm really just kind of blown away at how big this is, and you're right. People are not talking about it. There's that stigma. I couldn't agree with you more.
Yeah. So again, I'd love to have conversations with everybody. And again, you know, it's a hard conversation to talk about. It's a depressing one, but we don't have to make it depressing. You know, and the TV show and the radio show and the podcast I did is about bringing hope to people that are struggling with mental health and suicidal thoughts and lost survivors. I say to everyone, I have lived experience. I'm not a professional, but I have lived experience. So, you know, hey, we just got to all band together, and you know, just by being nice to somebody, not knowing it, you could save somebody's life.
Would you recommend your show for, we our very close friends lost their son in August to suicide. Would you recommend your show for that family, or what do you think?
So there's a lot of, and I'd be happy to talk to them personally too. But so the show, I don't bring out anything negative in the show. So we don't talk about why people do it. We don't talk about how people do it. We talk about bringing, so like my guest next week is a veteran that started an organization, Mission Zero. So he's going to be on talking about the great things he's doing. I have an organization called Recovery Unplugged that is a substance abuse facility, talking about how they help people. So it's all about helping. And you'll find a lot of these people that do all this have gone through it. So, you know, Dr. Barry, who's going to come on for Recovery Unplugged today, actually, he posted, I think he's 24 years sobriety. So it's all people that have been through it that can help other people. So yeah, I mean, absolutely.
Thanks.
Alan, thank you for sharing your story, and I'm really sorry for your loss too.
Thank you.
I want to ask you, has there been any research, or have you ever worked with energy healers at all?
So I don't know of any research that has gone on with that. I'm open to talking to anybody. I've talked to people that have done, you know, hyperbaric chambers. I was talking with someone at Oriental Medicine. I believe, so my belief, and this is one of the things I try to come across on, yes, medicine is necessary in certain instances. I'll give you a quick story if we have a couple of minutes. My son, when we came down to Florida, I could go into a couple stories with this. My son, when he came down to Florida, he was going to high school and he was getting a lot of anxiety. He wouldn't go to school anymore. He wasn't getting up. He'd be in the nurse's office more than he was in the classroom. So we learned about the hospital homebound program that Florida has, which is phenomenal. We pulled him out of school. We had to get we had to get his psychiatrist to sign off on it. We brought it to the psychiatrist. Psychiatrist says, yeah, I'll sign this. I'm not happy about doing it, but I'll sign it, but we got to increase his medication. I said, why am I increasing his medication? Because he has anxiety, you know, and he has to get out of school. I'm like, yeah, but we're taking him out of that environment. Why can't we wait until we see how his anxiety levels are being out of the school and doing it at home? And I refused to increase his medication. Turns out that he didn't need his medication increased. He needed to be out of that environment and learn how to deal with it. I believe that medication, yes, I'm not saying that medication is not necessary, but also healthy eating, exercise, yoga, meditation. You got to get everything and find what fits for you. So if what you're talking about is something that helps somebody, yes, you got to put all those ingredients together to create a well-being and a healthy mental, mindset.
Well, I've just worked with them myself and have been incredible. Like, I've been in a place where I had a lot of things happen. Both my parents were very sick. I was going through all this stuff. I was really depressed, actually, for like a month. I couldn't snap myself out of it. And a friend of mine is a shaman, and she did an energy healing on me, and it was like It was
Actually,
like a light switch. It was
I shouldn't say that. I forgot. I did have recently Jessica, who's I forget, a Reiki, does Reiki, and we had a yoga instructor and a bunch on our show that were phenomenal. I haven't personally experienced it myself yet. I do want to learn more about that though.
it's just a great tool also, just to put in the toolbox.
Yeah, no, I agree.